Okay, dear students, today we will talk about cynosis. So first of all, the definition of cynosis. Cynosis is a blue color seen through the skin and mucous membrane when the reduced hemoglobin concentration in capillary blood exceeds 5.0 gram per deciliter. The amount of oxyhemoglobin does not affect the color. So it means is that when you will see this cyanosis is a blue color that you can see on the skin when in the hemoglobin concentration, reduced hemoglobin concentration means they can having the less oxygen with that. In the capillary blood is 5.0 gram per deciliter, and amount of oxyhemoglobin, it means is that how much oxygen, if it is more oxygen like hemoglobin, it does not affect any color, but reduce like less oxygen in the hemoglobin can give the skin or mucous membranes a blue color. So you can see in this picture different on the lips, and in this fingers, and this one is blue. This kind of blue color you can see in the cyanosis. So this mechanisms like molecular structure of hemoglobin. The hemoglobin has two peptide chain and two beta chains, right? And these peptide chain has a ferroheme, and ferroheme can combine one oxygen. So you see in the different these chains, one ferroheme, and this will combine with the oxygen, right? So Hb, if oxyhemoglobin means is when it is having the oxygen, it will looks red, okay? And then if reduced hemoglobin, it will give the skin blue color. So mechanism. The degree of blood oxygen express the amount of reduced hemoglobin. So this blood oxygen will tell you that how much is your hemoglobin is lacking the lacking the oxygen. So mechanism number one, in general cyanosis become apparent. Apparent means obvious when the mean capillary concentration of reduced hemoglobin exceed 50 gram per liter or 5 gram per deciliter. It is the absolute rather than the relative quantity of reduced hemoglobin that is important in producing cyanosis. Abnormal hemoglobin pigments is present in the blood is methemoglobin is 30 gram per liter and self-hemoglobin is 5 gram per liters. The increasing amount of absolute reduced hemoglobin. This reduced hemoglobin concentration in capillary blood exceed 50 gram per liter. Especially, I can give you the example is like polycythemia and severe anemia. For example, because it is the absolute quantity of reduced hemoglobin in the blood that is responsible for the cyanosis. The higher the total hemoglobin content, the greater the tendency towards cyanosis. Thus, cyanosis is detectable in patients with marked polycythemia at higher level of arterial oxygen saturation than in the patient with normal hematocrit value. And cyanosis may be absent in patients with anemia despite marked arterial desaturation. So in the clinical occurrence, the amount of the absolute reduced hemoglobin increase in the central cyanosis, peripheral cyanosis, and mixed cyanosis. What is central cyanosis? Central cyanosis is characterized with generalized cyanosis, and it is caused by the basic cardiac and lung diseases. In the central type, the saturation of oxygen, that is arterial oxygen saturation, is decreased, and bluish discoloration is present all over the body, but the skin is warm. Yeah. So this one you should be remembering in central cyanosis due to the cardiac or lung diseases. Where there is a defect, like due to some problem, the saturation of oxygen is decreased, so the bluish coloration will be present in whole body. But the point here is that in this case the skin will be still warm. So what are the causes? Pulmonary cyanosis is caused by deficient oxygenation resulting from pulmonary failure. What are the pulmonary failure? Like airway obstruction, pulmonary disease, and pleural disease. In this all diseases, let's suppose here is obstruction in the lungs. So if there is obstruction, there will be reduced supply of the oxygen. And from the lungs, the oxygen diffused to the blood. So if there is obstruction or due to some cases that oxygen is not diffusing to the blood, or there will be reduced oxygen supply, and that will create cyanosis. On the other hand, the cardiac cyanosis, right to left shunt, like congenital heart diseases, tetralogy of Fallot, and Eisenmenger syndrome. So what happens? Right to left shunt, that for example this is your heart. If for example hole here, from the right side the blood will move to the left side and mix with the left ventricle of the heart, and then because on the right side there is a deoxygenated, the left side is oxygenated blood, will mix the oxygenated and deoxygenated blood and then will move to the body. So the de so the what happened, the deoxygenated oxygen blood will be more, and then this will cause cyanosis. Peripheral cyanosis occurs when the blood is deoxygenated in the vessels in venous tissue or in the tissue from extravasation. So what in the peripheral, where you will see is the bluish discoloration seen in the acral areas and lower location. But remember, the skin is cold in the cyanotic parts. Right? Okay, so here you can see this one is blue and this is red. So acute arterial thrombosis of right leg. Well, it will be peripheral cyanosis, it will be mostly not everywhere. Mostly it happens on the distant sides. Okay, mostly in the lower legs and like these kind hands and these locations. So ischemic peripheral cyanosis may be due to reduced cardiac output or local vasoconstriction. Okay, or congestive peripheral cyanosis, congestion of systemic circulation, like right heart failure, constrictive pericarditis, and superior vena cava obstruction syndrome. So in these all situations, what will happen, that the blood to the right heart or due to some problem, it will stay more in the venous system. So what happened, that there, due to the stasis, the blood will not, the oxygen will used up, and this blood will be more deoxygenated, and more deoxygenated blood, then this will cause you cyanosis. Or in some local vasoconstriction, what will happen, that this area will not be getting enough oxygen due to vasoconstriction, the blood will be not moving there, and then these areas, like for example these fingers, here is a vasoconstriction. So if the blood is not moving there properly, with the time there will be this area will be oxygen deficient, and then become turned blue. Mixed cyanosis, central cyanosis and peripheral cyanosis occur at the same time. So this is the mixed cyanosis, that this will occur, both of these conditions occur at the same time. The blood is insufficiently oxygenated because the lungs is congested, or more deoxygenation due to slow peripheral circulation, blood flow in peripheral capillary vessels. So both of them occurs at the same time. Main point of identification. Main point of identification: central cyanosis, also systemic cyanosis. Like it will be mostly obvious on trunks, limbs, and whole body, but the skin is warm here. But peripheral cyanosis, you can see is mostly on the end of the limbs or lower sides like nail beds or ears. So central cyanosis usually become more prominent when exertion or exposure to the warm environment, but peripheral cyanosis does not. So this point you should be keeping in mind. So the difference between central or peripheral cyanosis, here is a chart like cyanosis, central, peripheral. Skin temperature here will be warm, here will be cool, and then massaging or warming. In the central cyanosis, there will be no change. Peripheral cyanosis will be fades away. Okay, it will be disappear with warming or massaging. Etiology. Now we will talk about etiology. One of the etiology, abnormal hemoglobin pigments in the blood. The structure of hemoglobin change, or some hemoglobin cannot carry enough oxygen as before. So this can be the causes of cyanosis. So what are the abnormal hemoglobin pigments in the blood? The first abnormal hemoglobin pigment is methemoglobinemia. When the methemoglobinemia concentration exceeds 30 gram per liter, cyanosis will occur. Most of the methemoglobinemia is acquired due to drug or chemical poisoning. Occasionally is congenital methemoglobinemia. So this is one of the cause. If this abnormal pigment in the blood is exceeded 30 gram per liter, it will cause the cyanosis. The second is self-hemoglobinemia. When the self-hemoglobin concentration exceeds 50 gram per liter, 5 gram per liter, cyanosis will occur. And this is also acquired the patient of self-hemoglobinemia who takes the sulfadic food with constipation at the same time. So this pigment, if increase this value, exceed this value, you will also develop cyanosis. So accompanying symptoms here, cyanosis with dyspnea, cyanosis with clubbed finger, and cyanosis with disorder of consciousness. So one by one, cyanosis with dyspnea, commonly found in severe pulmonary and cardiovascular disease, or you can see in the obstruction of the airway and so on. What is dyspnea? Dyspnea is the feelings of breathlessness. If you see cyanosis with clubbed finger, usually this will be indicating toward the disease with long last history. For example, cyanotic heart disease and some chronic pulmonary diseases. So in this case, you will see cyanosis with clubbed fingers. And cyanosis with disorder of consciousness. So this will indicate the medicine or chemical poisoning, shock, or severe acute pulmonary infections or severe acute heart failure. So point of inquisition here, age of onset, you will be asking sex and then the site of cyanosis and features and inducement and the course of cyanosis. For example, you can ask is age of onset, what is really early age, maybe there is a congenital heart disease. Sites can tell you like it's a central, peripheral or mixed, and then inducement like for example cold, hot, which thing can reduce or increase this cyanosis, so that will quickly lead you to diagnosis. So here you can see age of onsets like for example SEC, congenital heart diseases, cyanosis begins in infancy, idiopathic paroxysmal methemoglobinemia, and women of childbearing age, cyanosis associated with menses. Site of cyanosis, the type of cyanosis, then accompanying symptom, basic disease like chest pain, syncope, palpitation, cough, and then inducement and course of cyanosis without basic pulmonary and cardiovascular disease. Ask for patient whether taking some special food, drug, chemical poisoning, and constipation at the same time. Okay, thank you very much. So our lecture is over and I hope you have learned something.